आपकी स्कूलिंग, आपका डिग्री कॉलेज एंड आपकी जर्नी के बारे में।
Okay, so basically I started in a middle class family in Aurangabad. I did my schooling in a very average college, or let's say government college, government school. After that I went to my 11th 12th NEET UG preparations, got into the good government medical college Aurangabad. I did my MBBS over there, and finally I finished my MD medicine in Mumbai. So after that now I'm a practicing physician. I work in Divapathy Hospital. So apart from that, I've started my creator journey as well as a health awareness videos as well as a medical educator. So it kind of help you to stay updated and to keep the knowledge to the date. So that's simple and short journey.
आपको हमेशा से डॉक्टर ही बनना था?
Actually initially as a weird dreams are there, right? So somebody wants to be astronaut, somebody wants to be scientist, etc. So every average Indian kid wants to be cricketer one day. So I was also one of that. But it's all right. As I grown up, I knew that it's not easy, right? If people think that it is quite easy to be cricketer and get into any other profession, but for me, coming from the middle class family, to go it through the traditional way, educational way was the only way. So my parent could afford only that part. So they got into me a good coaching institute at 11th 12th. I got good rank and got into MBBS. So that's how journey started in MBBS, and as a doctor also.
ओके, सो आप कब से DY पाटिल के साथ हैं?
I've recently joined 3-4 months back. So I finished my residency last year. After that, I worked at government setup. But after few months, I thought that DY Patil is a good option because I was not attached by the affiliated bonds or anything. So I thought that we have good patient loads at DY and all. So it's good practice.
डॉक्टर होने का सबसे फायदेमंद चीज या the best part of being a doctor?
Actually, the best part of being doctor is there are a lot of, but most is what you feel satisfactory feeling is there when you treat your patient completely. जब आप patient के लिए treatment देते हैं पूरा, and they gratitude yourself, they thank you, and you see the patient came in ambulance or something like that and just going home, walking themselves, and for a lifetime they remember you. आपको याद रखते हैं हमेशा के लिए. So I think that's most rewarding thing. Apart from this, there are a lot of things like you can help your family then and then. So definitely you can have that quick lash over the other disorders which can trouble your family. So these are two of the most important rewards, I think.
Right. सबसे बेस्ट कहा जा सकता है कि जो पेशेंट्स आपको ब्लेसिंग्स देते हैं, तो अब तक का ऐसा टची मोमेंट किया, you felt just blessed?
Yeah, actually, so one patient was there. So he presented with cardiac arrest. So we did CPR in that patient. So CPR is basically to maintain circulation throughout your brain, right? So we kind of revived that patient. He had heart attack. So after that, relatives got really scared that this is heart attack and Papa already got this complete unconsciousness. So he's not going to live now. So, but after our successful efforts, we did CPR and all, and he recovered also. And after that, it's like every Diwali, every major festivals, they send sweets to me and all. So I think it's kind of a rewarding moment, right? Yes.
So आप उन्हें अपडेट करते हो that मैंने हॉस्पिटल चेंज कर लिया, एड्रेस बदल गया है?
नहीं, वो they are personally in contact with me, not in relation to the hospital. They personally contact me, so that's good thing, right?
It's really great.
Yeah.
अभी 12th के रिजल्ट्स आए हैं एंड बहुत से स्टूडेंट्स होते हैं जिन्हें करियर बनाना होता है इस प्रोफेशन में. उनके लिए क्या एडवाइस होगा आपके लिए?
I think they should just prepare themselves. That journey is too long. They should not think that they'll quickly get and earn money in the medical profession. So the MBBS journey itself is about 6 years, right? So 4.5 years for your education, 1 year for your internship. Obviously, they have increased the pay in internship right now, but it's minimal. Considering next 5-6 years, it will be minimal. So just wanted to tell them it's all right. You have chosen the medical profession. It's a good thing. India needs good doctors. But the only thing that you should have that mental preparedness, that's definitely you're going through a lot during these 6 years, and also that after that you're not going to get settled. You obviously have to do MD, DNB, whatever specialties you want to do, and even after specialty they will have to do super specialties in coming years. So the journey is about 12 to 13 years, right? So you have to be prepared from now. Don't want to scare anyone, but I think they should know the ground reality, what they are going through. So that's why they can stay focused throughout their journey, and that will help definitely in longer run.
वंडरफुल। तो डॉक्टर विशाल, मुझे सबसे पहले आपसे यही समझना है, जब बर्न होता है, जब हम घर पे जल जाते हैं, तो सबसे पहले जो फर्स्ट एड होना चाहिए ट्रीटमेंट के लिए, व्हाट वी डू बेसिकली, पानी, गर्म ठंडा पानी या टूथपेस्ट लगा लो। एज अ डॉक्टर आप क्या कहेंगे?
एक्चुअली मैंने बहुत से पेशेंट्स देखे हैं जिसमें दे प्रेजेंट विद समवन हैज अप्लाइड टूथपेस्ट, किसी ने बटर लगा दिया, किसी ने घी डाल दिया, किसी ने कोई पत्ता, झाड़ का पेड़ का पत्ता लगा दिया. So this is completely wrong approach. I would say the correct approach is whenever someone is having burn, it's all right. The first thing is obviously not to panic. दूसरी बात रहती है कि they should apply cool water, okay? Not chilled cold water, not chilled beer, etc. They should not apply ice. Just cool water, okay? Lukewarm or cool water is all right. Just to clear the injury or wound wherever the burn has occurred. Second thing, I want them to cover the wound. वो wound है वो cover करना है आपको with the cloth, any sterile cloth, any clean cloth से आपको वो cover करना है, because अगर वो open रखेंगे so obviously the surrounding bacteria, surrounding infections can occur there, and because of this patient may not die of burn but may die of infections. Okay, so the second thing is that, and third thing is obviously you have to take the patient to the hospital. Now there are again a grading of the burn. So there are 3 top grades. First grade or grade 1 burn, आपके skin की superficial जो epidermis रहती है, that is involved. So you will exactly see your red type of skin. Red type of skin, लाल हो जाएगी skin. That is the grade 1 of the burn. Second grade is when the burn is reaching your dermis. That is the deeper level of the skin. अगर deep जाती है burn, so again the first initial aid treatment will not change. The only thing will change is the treatment course. Patient will have to stay in the hospital for the longer time. And third is your skin will completely become like a coal, charred skin, and that is grade 3 burn, and it's kind of difficult to manage also. So most importantly, patient has to focus on the cleaning of the wound with the cool water, not cold water, not chilled water. Second thing, they should cover the wound with a sterile cloth. So these 2 things they should focus, and after that obviously they have to go to the hospital as soon as possible.
So no toothpaste?
Yeah. No toothpaste, no butter, no ghee, nothing.
So
okay?
Because you're mentioning ghee, beer, लोगों ने ऐसे किया हुआ है? You have seen patients?
Yeah. People do that. Yes.
And that is absolutely wrong.
Absolutely wrong. I have seen some people who put Fanta, this Sprite or something.
My God, Sprites and Fanta.
Sprite,
My God.
So it's pathetic, yeah. Okay, in short, for summary, first thing is you have to clean the wound with the running water. Cool water it should be, not chilled or not anything else than that, like आपके पास घी है, butter है, you can't apply that. Okay. Second thing is you have to apply the sterile cloth. Apart from that, if you have any ointment like Bernol है, किसके पास कोई Supramycin वगैरह, these antibiotics are commonly used in burn cases. So after cleaning the wound, you can apply just to cool in the patient and just to give some relief. And even if you have some pain meds like paracetamol, etc., you can take that and you can go to the hospital as soon as possible, because main treatment is hydration, which can be given via IV lines. तो आपको इस पे ज्यादा ध्यान देना है कि हॉस्पिटल चले जाए, because their expert team is obviously there, right? So they will handle most of the cases. So but before that you should do these things.
Okay. डॉग बाइट के केसेस में सबसे पहला फर्स्ट एड क्या होना चाहिए, और ट्रीटमेंट जो अपडेटेड ट्रीटमेंट है वो क्या अवेलेबल है?
Okay, so basically dog bite is quite dangerous actually. It causes rabies. Even dog bite, rat bite, and even your cat bite can also cause rabies. So even bat's bite can also cause rabies. So it's basically a virus which is carried by the animals, called as a zoonotic disease, which is carried by the animals. So dog bite की वजह से जो rabies होता है, any type of rabies is actually fatal. Okay, fatal. So 99% of the time patient may die because treatment is not available. So because of that, you have to take care about the preventive things, what you should do in the initial stages. So the first thing is first aid. कभी भी आपको dog bite होता है, so the first thing is you have to do is to clean the wound again with the running tap water. You don't have to apply any compression band. You don't have to suck the wound, and obviously because the dog bite, the virus reaches your wound and it takes time to go to the brain. So rabies virus lives in your brain basically. So if you suck the wound, again you kind of give a pathway for that virus to quickly reach the brain. Okay, so that's why you should not apply compression bands. Actually, initial times they used to say that you can apply compression bands because this virus will take some time to reach the brain, etc. But actually this is now been scrapped. You should not apply compression bands. Because of that, there can be venous obstruction, and again gangrene may happen. So that's why nowadays the one thing is you should just clean the wound with the running water, tap water. Second is you again can apply sterile cloth to that, but don't compress it, don't apply tourniquet, etc. Third thing is again you don't apply any other antibiotics, etc. If patient is in pain, use some pain medicines and take him to the hospital. In hospital, depending on the depth of the dog bite and the severity of the injury, doctor will decide the treatment. So in the first phase, he will only give, if patient has got scratch or something like that, he will just manage conservatively, clean the wound, etc. Second thing, if patient might have got deeper injury at the dermis level, he might give some rabies vaccine and human immunoglobulin, which can be taken out from the other patient who has got rabies. So our bodies have already created those antibodies, so we can instill those. Two things, rabies vaccine and human immunoglobulin, depending on the injury. And if the patient has even deeper injury, then definitely we have to give both of these. Okay, and in the subsequent duration, you have to take rabies vaccine again for 0, then again 3rd day, 7th day, 4th day and 20th day. So this is actually the ideal regime for the rabies vaccine. And if you have dog, if you have cat, so there is called as pre-exposure prophylaxis. Even before dog bite also you can take vaccine. The course is 0, 1 and 6. So in that period you can take vaccines for the if you have already pets.
So in that
in that case you can avoid rabies to the owners, all dog handlers, etc.
Okay.
Yes.